Hi, this is Kent Sovern, AARP Iowa State Director. With me, Andrew Carroll, Associate State Director for Advocacy, which means he's our lead lobbyist. Week 2, done at the state capitol.
Right.
What'd you learn?
Week 2, a lot of presentations happened this week from different department heads. Department heads that we really have a keen interest overline with the issues we're working on in the state. Our State Director of the Department of Aging, Donna Harvey, presented on the Department of Aging, her budget, what her budget looks like, and their efforts to improve how we access long-term care in the state, which for us is always a priority. Their department serving people where they want to be served for long-term care, and that is in their homes and communities. So there's efforts underway to consolidate area agencies on aging. That's been a multiple-year project, and as you do that, setting up a system that really improves how people access and get access to local home community services.
You bet, and I had the pleasure of sitting in with you on at least 2 of the committee meetings in Commerce. Right. Susan Voss, the retiring insurance commissioner, testified.
Yeah, Susan Voss, our insurance commissioner, talked to Commerce about variety of things, the amount of things that they regulate in their bills, things that they're looking at. I've also had some good discussion at the end on some good discussion and questions on how do we smartly implement ACA in Iowa, what are some lessons learned, what are some things that she's looking at. As you mentioned, her term ends actually, she's leaving at the end of this month. She served Iowa well, but there'll be a new commissioner. We look forward to his ideas. But for our sake, we really appreciate the conversation in both the House and Senate on how do we smartly implement ACA, the Affordable Care Act that is, in a way that will benefit Iowans the most and improve the way we receive health care in Iowa.
Well, I've been really pleased in my year and a half here with the AARP, the great relations we've had with Susan and her department, the teletown halls we've had, the SHIP, the State Health Insurance Information Program, teletown halls. They've been a great resource, and I think we've been a great help for them as well.
Yeah, I think it's been really, as you mentioned, that's a Senior Health Insurance Information Program, how people get information for open enrollment under Medicare Part D or Medicare Advantage plans that they might enroll in. That actually is housed in the Department of Insurance, so people understand that. And so a lot of the work that they do aligns with the work that we work on.
You bet, and I know that the ACA and its implementation and Medicaid expansion going to be huge issues for us this year, and fortunately I was able to sit in on a Medicaid 101 presentation, which I certainly learned a lot from.
Well, that's right, and it was Jennifer Vermeer. She's she's the head of what's called our Iowa Medicaid Enterprise Division of Department of Health and Human Services in Iowa. She runs Medicaid Enterprise, and the Medicaid 101, as we all know, we have a lot of new freshman lawmakers or people perhaps new to the Human Resource Committee, so it's always a good refresher for even people who've been around Medicaid. What does Medicaid look like in Iowa? And as a reminder, Medicaid is the program that serves low-income Iowans, people who are disabled. Oftentimes that aligns with us because you're talking about that's the payment mechanism for nursing home care or other long-term care systems. So not just you have on the long-term care side, which is a big cost driver as we're becoming an aging state. I think that was part of our presentation. But then also for us, not just our 65 plus or people receiving nursing home care, but the 50 to 64-year-olds who need quality care and perhaps have low income, they have a job, or they don't have a job, or they have a job that doesn't offer health care. How do we provide and make sure we're a state where we're offering a system where they can get quality, accessible health care coverage? And for us, as you mentioned, Medicaid expansion is a priority. We're going to be hearing more about that. We'll talk more about that in the future, but we think it's the right thing to do for Iowans to expand Medicaid up to, that's 133% of poverty level. And by doing that, as you were there, Jennifer talked about, we have what's called categorical eligibility. And really that's a sign that not everyone who is low income, even very low incomes, is eligible for Medicaid. So putting a system in place where people who have need, who paid into, by the way, we all pay into the system as taxpayers, that can access that health care coverage when they need it the most.
So there's lots to learn, And we're going to have our first 3 sessions out in the state this week. On Tuesday we'll be in Council Bluffs, and Wednesday North Liberty, and Thursday here in central Iowa. We'll have those dates and places posted on our website, www.aarp.org/Iowa or IA. You'll be able to get to our blog and learn more about that. In addition, of course, those of you who are Facebook fanatics, come on over to AARP Iowa, friend us on Facebook, and sign up for our Twitter feeds. We're out there, we're hip, we're new media, and we'll keep you posted as each week Anthony and I and others will bring you updates from the state capitol. Thank you very much for tuning in.
Thank you.